Alright guys, this is Brad with Despite Fitness, and today I got kind of a special treat. I'm hanging out with special treat, hanging out with Dr. Nate, and he's my osteopractic physical therapist.
Hey.
And he's been helping me out kind of all along the way from even before the bicep tear, but especially through the bicep tear. And just tries to do the best he can to keep me up and running and help me out with different musculoskeletal issues that I have.
Right.
So today, well, lately I've had a couple concerns. I've had some pain in my bicep, which is kind of a new thing since the repair. I've been fortunate not to have much pain, but I just feel some tightness, and so I think we're going to do some scraping and try to get that to release a little bit. And then I've had some issues from squatting with my adductor.
Your adductors, yep.
And then also just on the outside of my calf as well, kind of being tight. So we're going to do some dry needling and some other things that'll help out.
That's right. So with the bicep, we're going to do some instrument-assisted soft tissue massage. We'll use several. There are some tools that I use to do that. There are several brands that are used to do that. Some are proprietary. They're very protective of their copyright. So the brand that I use that is not as protective is Hot Grips. It's a brand that I would look into. They're very high quality tools. And then we'll do some dry needling of his adductor magnus. That's where he's getting his tightness with squatting, as well as along his soleus and his fibularis, the perennials on the side of his calf. And let's go with that.
Cool. Let's get after it.
So go ahead and take your shirt off and lie down on your back there. I always like to have him take his shirt off. Lie down on your back with your head up here.
All right.
Have access to your Actually, I think what we'll do is start off with the kneeling, so that can be rolling.
Sure.
While we do your bicep. Go ahead and relax this leg here.
So with the needling, what does that do?
Let me get them stuck in you, and we'll discuss it for a second.
Can't really have a fear of needles in this line of work, huh?
I used to have it. I almost did not do a certification in this strictly because of my issue that I have with needles. The nice thing about these is that these are about 1/8 of the size of what you get for injections.
Okay.
So they're a solid filament needle. There's no injectate with them. We're just going in, and one of the things we're trying to do is disrupt the tissue on purpose. I'm causing some inflammation in your adductor magnus on purpose. It's a focal inflammation causing just a little bit of tearing or disruption to your muscle there. And what that does is starts the inflammatory process over again. So at some point when you injured your adductor, the repair process took place, and that consists of inflammation, repair, and remodel. And somewhere along the way, that repair and remodel didn't happen like it should. So I'm inducing inflammation on purpose. We're going to call the factors of inflammation to that area to hopefully start to repair that tissue like it should be. That's one of the effects that we're looking for with dry needling. One of the other effects that occurs is that when I insert a needle into your muscle, or into other tissue, not just muscle, but soft tissues of the body, your brain responds by dumping what are called andamines into your system. Those are the body's own opioids. So instead of you having to take an oral opioid, you're getting your body's natural opioids as kind of a pain reliever.
Nice. You know, in the times that we've done this, you know, I have noticed, in fairly short order, within the span of the treatment and immediately following, you know, relief of pain.
Some of those might jump you a little bit. If any of those are super bothersome, we can take them out right away.
Too easy. Yeah, that hit on the spot, so I felt that.
Yeah. And then the remaining effect with dry needling is and I don't mean to be too scientific for you, but it clears out the neuromuscular junction. So where you have the nerve come down that meets the muscle is called the neuromuscular junction. And for a muscle to fire or to contract, there's an interaction between the nerve and the muscle where acetylcholine sets off what's called an action potential of the muscle. And when the nerve sends a signal and fires the muscle, it's operating like it should. Now with an injured muscle, acetylcholine will kind of collect in that junction. And that muscle, instead of firing and being done, it'll just kind of get a little bit tonic and hold on, okay? When I stick a needle in there, for whatever reason, that muscle kind of bounces back and it starts to clear the acetylcholine out of that neuromuscular junction. So I'm looking to reset the neuromuscular junction. So those are the three things we're looking for. Inflammation on purpose.
Right.
I want that opioid dump, andamines, and then a reset of the neuromuscular junction. When we connect electric to it, I'm getting you'll see it, the muscle will start to pump a little bit, and so I'm looking for that reaction that you got with when I put the needle in and the muscle kind of jumped. I'm looking for that repetitively over and over again.
Does that help flush the acetylcholine out?
I'm going to say yes.
Okay.
But probably a more appropriate answer is probably.
But just by the fact of it moving, it helps just kind of clear it up a little bit.
Well, at that point, I'm looking more at the lymphatic system, right? Because if I'm getting the muscle to contract, that's how lymphatics operates. That's how inflammation and swelling is cleared from an area, is through the lymphatic system.
Right.
And the lymphatic system only works with the contraction of the muscle, squeezes around the lymphatics and pushes fluid through it.
Gotcha.
So when I get a repeated contraction of the muscle, then I'm facilitating the lymphatic process.
Okay.
Okay, so let me know when you start to feel that thumping a little bit.
Yep.
That's a little bit too much. Let's back off a little bit. And right there should be about right. Feel okay with that?
Yeah, I feel that.
Okay. So we'll let that go. We'll get just a few in your calf here.
Cool.
Let's see here.
And so, how long have you been doing this?
I have been needling since 2013, I think. It's the first time you're going to go and relax it. We're good for that tension.
Yeah, that's the spot.
Right in there?
Yeah, that's the one.
But got very serious about my dry needling training and osteopractic training over this last year.
And so, you're going through some kind of special training, correct?
Yeah, part of that is a fellowship. So out of the over 200,000 physical therapists in this country, in the United States, less than 1,000 of us are fellowship trained.
Wow.
And so that's something that needs to get a little bit bigger. I'm just about to finish up what I consider to be the best fellowship, manual therapy fellowship program in the country through the American Academy of Manipulative Therapy. Finish that up in March.
Wow. It's pretty daunting achievement.
There have been a couple of times this year where I've been feeling like I'm getting my butt kicked, but it will certainly be worth it.
Yeah. Yeah, there's been a few times this last year or so I felt like I got my butt kicked too.
Yeah.
Yeah, going out to USPA Nationals and tearing my bicep off wasn't one of my high
That was
points.
not a cakewalk. Yeah.
But the recovery went pretty well. I mean, I was very pleased with, I was able to get in, and have it, surgically reattached.
You had a very good surgeon as
Yep,
well.
I had a very good surgeon.
Yeah.
So for this, what are we doing here now?
So for this, this is that soft tissue massage that we talked about. Instrument assisted soft tissue massage, sometimes abbreviated as IA stim. So when you have muscle tissue or soft tissue that's repairing, if you look at pictures, anatomy pictures of muscle or tendon, you see those nice, pretty straight lines, right? That you're trying to that is typical normal tissue. And now when a muscle tears, for instance, and it tries to repair, it lays down new fibers kind of in a skewampus crisscross shape. And that's more like scar tissue. That's not contractile tissue like you want in a muscle. So now with movement, with repetitively moving that muscle, hopefully over time it's starting to line up. And this is an effort to facilitate that, try to help it. Basically, one patient described it to me, comb the fibers, right? We're going to comb. Now, also, when you have a disruption in that tissue, it's going to adhere to the surrounding layers. So there's muscle on top of that. There's some fascia lines above that, your subcutaneous fat, and then the skin. And each of those, for instance, when they cut through your skin, you want to be careful that that doesn't adhere to underlying structures. And this is an attempt to break up that kind of those scar tissue areas and damaged tissue. So trying to realign those fibers.
And how does this technique compare or contrast with something like Graston or like gua sha?
So that's where when I mentioned those that are proprietary about their brand name, Graston is very much like that. So you may consider cutting that out of your video. They have very good tools, very good training programs. So for instance, right now, I would not say I'm doing a Graston technique because I've not been trained by Graston and not using Graston tools.
Gotcha.
Now, I've witnessed Graston techniques being done, and I would say that they're similar, but again, I would not claim that I'm doing Graston this time.
Fair enough. So, like, essentially, it's a proprietary technique, so it's
for that
similar
company,
but not the same.
For that company, yes.
Now, so like I've seen stuff, and I'm sure other people have on the internet where they do like a gua sha, where they're scraping with some kind of a bone. And with that scraping, they tend to get a lot of like redness and bruising and petechia.
Yeah.
Like, how is that different than this, and is there more utility for one than the other?
So one, it's I would say just a different level of force that you're using. I mean, if I took these and really ground in there, and I have actually with some very knotted up tissue or something that just feels like it just needs to be broken up, I'll get pretty aggressive with it. And actually, I don't know the name of the study. I can get it to you later. I presented to the Florida chapter of the National Strength and Conditioning Association, a bunch of PTs and strength coaches. It's a study that took biopsies of animal tissue after it had been through light instrument-assisted soft tissue massage, moderate, and heavy, and measured the fibroblastic activity in that tissue after each procedure. And the fibroblastic activity in that connective tissue was much greater according to the stress that was put on it. So heavy stress, lots of fibroblastic activity. Light stress, just a little bit.
And fibroblasts are the cell responsible for building tissue?
For connective tissue, for repair. Yeah.
Very cool.
So sometimes firmer pressure is better, and that's one of the reasons that I've really kind of bought into and really liked what Donnie Thompson has done with body tempering, because that's about as heavy as you get as far as soft tissue, instrument assisted, if you want to call a 150-pound roller an instrument assisted soft tissue work. Right?
Yeah, and for a lot of my own stuff that I do by myself, I follow a lot of Donnie Thompson stuff as well. Mm-hmm. Trying to do some rolling, some of his lower back protocol and things like that to try to help myself out. So, the last, 2 or 3 years, my attitude toward recovery has changed considerably from what it used to be.
Yeah.
I never thought much of recovery when I was younger.
Yeah.
But I realize now that it's really the part of the game. It's really the game changer.
Yeah.
So if you can recover well, or you can get yourself back to optimal condition, then you can really be able to perform much better across the board.
Yeah, so for Christmas, I bought myself a Fitbit and one for my wife as well. And I would say I don't care about tracking steps, although that's fun, and tracking physical activity, that's great. Sleep.
Yeah.
That's been an eye-opener for me, because I knew I wasn't getting enough sleep. I didn't realize that I was averaging 5 hours and 20 minutes a night.
Wow.
So that's got to change, man.
Yeah.
Because I'm 40 now. So now the thing with that is you talk about recovery. I mean, my goal as an osteopractic physical therapist, and especially one that's into sports and elite athletes like yourself, I love treating CrossFit people. People make fun of CrossFit. I don't. My wife's a CrossFit coach. It's changed a lot of lives, and as long as we're helping people stay safe doing it, it's, in my opinion, not any worse than running was and quote unquote causing injuries in the 1970s.
Yeah.
My goal as your practitioner is not to say you shouldn't lift anymore, right? My goal is how can we get you lifting again? And the same thing with somebody that wants to run. My goal is how can we get them running again? And I found that some of these modalities, we've got to think a little bit more and apply a little bit better what's available to our patients, rather than just hand them a sheet of exercises and say, go do this.
Yeah.
You know how to exercise.
Right.
You're exercising all the time. I want to facilitate it so that you can do it safely and correctly. It's probably not enough time for that. So typically we want at least 10 minutes of tissue disruption.
Okay.
Some studies show that 20 minutes is better, but 10 is probably about good for today. Doing okay with those?
Oh yeah.
Oh, sorry.
No worries. I'm tough. If I can handle my bicep getting torn without crying, I think I can handle this.
Yeah, well, got a lot of adrenaline running at that time too.
Yeah. That's like the first question people ask is, how'd that feel?
You're like, I just kind of shrugged it off.
The truth is I didn't feel it.
Right on.
Hold up.
Yeah, you're all set.
All right. So that's a round of treatment with Dr. Nate. Going through some of the stuff that we typically go through, trying to keep me up and running and going strong. I've been bugging Dr. Nate for a while about doing a video because I think the stuff that he does is so beneficial. It really helps me, really makes a difference in my training and how I approach things. And I can't stress enough that how much my training and recovery has improved since I started working with him. So, that's one of the things I talked about in one of my other previous videos, is about the community of the sport and building a team. But the team is more than just powerlifters. It's more than just the people you train with. It's also the people that aren't there on the platform or aren't there in the gym with you, helping you get things done. So if you have little issues and things like that, there's a fine line between tough and dumb. So it's, if you have things that are issues now, they're going to be issues later. Then it's best to come in and find somebody that can help you work with the issues that you had, help you kind of get to where you want to be. And like Dr. Nate said, is the way that he looks at his job is not to tell me that I shouldn't do something, but to do the best that he can to improve my ability to continue doing what I want to do. So I wanted to make sure that I made a special video to highlight one of the members of my team, or maybe I'm on your team, I don't know.
Yeah, we're on each other's team.
Yeah, but someone that I work very closely with, and I've been working very closely with for a long time now, that has made a tremendous difference in my performance, and it has also made a world of difference in my ability to recover from a fairly traumatic injury.
Right on. It's been a pleasure.
So, thanks, Doc. Appreciate it. Hey, what's up, guys? Just leaving, seeing Dr. Nate, and got some treatment, and so I wanted to shoot some video with him because, like I mentioned, he's a guy that's kind of kept me going, and so in my as I've gotten a little bit older, I've realized the importance, the necessity of proper recovery, proper rehabilitation, and I'll be honest, he's made a huge difference in my recovery. And I don't think coming back from the bicep tear would have been nearly as smooth without him in my corner, among others. But Dr. Nate's really made a world of difference for me. So I wanted to take a minute. I wanted to highlight some of the stuff that he's done for me. And I was asking some questions I already knew the answers to, but just some topic of conversation to kind of inform a little bit. We'd mentioned a few different techniques, and the reason why we did that was just to highlight the difference, because you may have heard of one or all of those techniques, but the reality is they're not all the same. They're a little bit different, owned by different companies or different brands, and so just wanted to make sure that people understood what the difference is, or that one isn't necessarily the same as the others, more or less. But anyway, so that's the video. I hope you liked the video. Gave you some ideas about how you can improve your performance, and maybe some ways that you can help improve your recovery. These are just some of the techniques that I've used. I'd love to hear what else, maybe you guys do that you think has made a big difference in your life. But that's it, man. Just share some knowledge, try to share some techniques, show you how we do things, and, try to be better. Always trying to be better. That's the video. If you liked the video, hit that like button for me. I appreciate that. Share the video with a friend, family, somebody, some other lifter that you know that I don't. See if you can get them switched onto the channel. And please, 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 please subscribe. We're bumping up every week. I think we got 41 followers right now, or 41 subscribers. And I'm super pleased about that. We're growing. It's getting bigger. Small steps, but it's awesome. I'm glad everyone's along for the ride. No matter what you have holding you back, no matter what your excuses are, remember, train despite. Later.